Hello everyone, so welcome to our channel Medico Prime Education. So in today video lecture we will discuss the anatomy of testes. So this topic is not so much important for your university exam, but this topic is very important for the gross structure, gross anatomy. You must have to remember. मैं इतना बड़ा ज़्यादा इसको टॉपिक को लंबा नहीं करूँगा, ठीक है। मैं बस इसको समरी के बेस पे स्लाइड बना के लाया हूँ, उसके बेस पे मैं आपको सारा चीज़ बताऊंगा। जैसे कि एक्सटर्नल फीचर पूरे एक स्लाइड में आ जाएगा, फिर उसके बाद टेस्टिस का इस तरीके से डायग्राम है, फिर उसके बाद कवरिंग पूरा एक स्लाइड में। इतनी ये दो चीज़ें समझ में आनी चाहिए। दूसरी बात, आर्टरी सप्लाई एंड वेनस सप्लाई समझ में आनी चाहिए, इंपॉर्टेंट है। एंड एम्ब्रायोलॉजिकल जो रेमिनेंट्स है इन रिलेटेड टू टेस्टिस एंड एपिडिडाइमिस ऑल्सो, सो ये चीज़ आनी चाहिए। लास्टली हम लोग बात करेंगे हाइड्रोसील के बारे में, एंड फाइनली ये जो डायग्राम है ये आपको टेस्टिस का मैं आपको एनाटॉमी बताऊंगा। फाइनली आपको शॉर्ट नोट्स आता है इसमें डिसेंडेंट्स ऑफ टेस्टिस में, ठीक है। तो इस पे शॉर्ट नोट्स आता है, तो वेरी इंपॉर्टेंट फॉर द एम्ब्रायोलॉजी के लिए। अगर बहुत अगर ज़्यादा से ज़्यादा इंपॉर्टेंट के बारे में बात करें तो ये आता है, ठीक है। ओके, तो ये शॉर्ट नोट्स में आपको इतनी चीज़ एक्सप्लेन करना पड़ेगा और ये डायग्राम आपको बनाना पड़ेगा, ठीक है। Okay, so let's move to the our topic, anatomy of testes. So basically this is very important for your viva purpose and gross structure. Okay, so what is the testis? Testis is the male gonad. As you know, it is homologous to the ovary in the females, and also it is a mobile organ. It is a mobile organ and lie in the each half of the scrotal sac. So it lies in the each half of the scrotal sac. What is the function of testis? It helps in the production of spermatozoa. Okay, so it helps in the production of spermatozoa and secretion of testosterone, ठीक है। टेस्टोस्टेरोन या डाइहाइड्रोटेस्टोस्टेरोन, बेसिकली टेस्टोस्टेरोन ही चेंज हो जाता है डाइहाइड्रोटेस्टोस्टेरोन में इन द प्रेजेंस ऑफ अल्फा रिडक्टेज, 5 अल्फा रिडक्टेज। ओके, so this know you in biochemistry also you. Okay, so it is the male hormone which is responsible for development and maintenance of the secondary sexual characteristics and maleness. Okay, so this all you know in the physiology and biochemistry itself. So our main motto to understand what are the shape of the testes. So this is the oval shaped and it compresses from the side to side. Okay, so if we see from the side it is compressed like that. Okay, and you can see the real diagram of the testis. In this diagram here you can see this is it is a side view. It is a side view of the testis, and a part of that it is compressed from this side and from this side. मतलब left और right दोनों तरफ से अब compressed है, it is compressed from left to right. Okay, so understand this point. What are the position? What is the position of the testis? Okay, first we have to know the measurement. Its measurement is 4 into 3 into 2.5 centimeter, and length is 4 centimeter, breadth is 2.5 centimeter, and anterior posterior diameter is 3 centimeter. Okay, anterior posterior diameter is 3 centimeter, and weight is 10 to 15 gram. Okay, so the position of the scrotum. अब स्क्रोटम में कहाँ होता है? It is suspended in the scrotum by a spermatic cord. Okay, and it lies obliquely so that the upper pole is tilted slightly forward and laterally, and lower poles backward and medially. तो lower pole कहाँ होता है? Backward होता है and medially होता है slightly. Okay, so obliquely and its upper pole is tilted slightly forward. Okay, and a part of that left testis is lies slightly at the lower level. Okay, so this is very important question. जो लेफ्ट टेस्टिस होता है ना वो स्लाइटली लोअर होता है एट द राइट लेवल के अकॉर्डिंग अगर कंपेयर करते हैं तो। क्यों? क्योंकि जो लेफ्ट स्पर्मेटिक कॉर्ड है वो लॉन्गर होता है। ओके, लॉन्गर होता है राइट से, ठीक है। और जब तुम पढ़ोगे डिसेंडेड ऑफ टेस्टिस में, अगर डीपली अगर तुम लोग पढ़ोगे तो उसमें दिखेगा कि लेफ्ट टेस्टिस पहले डिसेंड होना स्टार्ट होता है, ठीक है। अब हम लोग बात करते हैं एक्सटर्नल फीचर्स. सो हाउ योर वाइवा will go like external feature. You have to explain the external features that you will say the testis shows the two poles, two borders and two surface. Okay, all are two. So there are two poles. There are two poles, upper poles and lower poles. Okay, there are two borders, anterior border and posterior border. Okay, so it is like that. It is the anterior border. If we see on the lateral side, we can see the anterior border, and this is the posterior border. Okay, so this is the posterior border. So here you can see that there are two borders and there are two surfaces. There is a medial surface and the lateral surface. Here you can see all through the lateral surface, and from this side you can see the medial surface. So there are two surfaces. Okay, so we we have to understand each of them. Upper surface, upper poles provides attachment to the spermatic cord. So it is provide attachment to the spermatic cord. Okay, and lower pole, it is convex and smooth. Okay, so just remember, it is convex and smooth. Now there are two borders. Anterior borders, it is rounded and completely covered by the tunica vaginalis. So this is the anterior border. It is rounded and completely covered by the tunica vaginalis. What is tunica vaginalis? It is the outermost covering of the testis. So it covers anteriorly whole throughout the testis. Okay, so here you can see this is the parietal layer and visceral layer. Parietal and visceral layer forms the tunica vaginalis, and it covers whole through the you can see appreciate like that. Okay, so whole through the it can cover totally the anterior pole. Understand this point? Okay, so next point is that posterior border, it is straight and covered. It is straight and covered only partly by the tunica vaginalis. So posterior border is covered partly by the tunica vaginalis, not totally it is covered. Understand this point? So तो अब हमें क्या देखना है, कवरिंग समझ में आ गया, ठीक है। कवरिंग धीरे धीरे मैं आपको एक्सप्लेन करूंगा। उससे पहले क्या है कि यहाँ पर मैं ये क्या प्रोवाइड करता है, पोस्टीरियर बॉर्डर प्रोवाइड्स द अटैचमेंट ऑफ एपिडिडाइमिस। ओके, so posterior border provides the attachment of epididymis. So it provides the attachment to the epididymis. So here you can see this is the posterior border, this is the posterior border, and provides the attachment to the epididymis. This is the epididymis, the head of the epididymis, the body of epididymis, and this is the tail of the epididymis. Okay, so now you can see here on the lateral aspect of the epididymis there is a separate. Now you can see the two surface. There is a lateral surface and a medial surface, but you can see the lateral aspect of the epididymis separated from the testis by the extension of a cavity of the tunica vaginalis called sinus of epididymis. So very important question and viva question or MCQ. Here you can see the sinus of epididymis. Okay, so there is a space between the lateral border, posterior border and lateral surface. There is a space which space क्या space होता है ये, this is the space lateral space separated from the testis by the extension of cavity of the tunica vaginalis. तो ट्यूनिका वेजाइनलिस का कुछ कैविटी बच जाता है, उस कैविटी वो कैविटी क्या बनाता है, साइनस ऑफ एपिडिडाइमिस. सो हियर वन मोर डायग्राम. हियर यू कैन सी in this diagram you can see appreciate there is sinus of epididymis. This type of sinus you can see, and this is also sinus. Here you can see the sinus of epididymis. Okay, so you have to first understand the what is the anatomical position of the testis. What is the anatomical position of the testis, you can see. Okay, so first you have to take out the spermatic cord like that, and put the anterior border towards the anterior and put the posterior border towards the posterior side, and put the lateral border towards the outside, because the lateral border या साइनस ऑफ एपिडिडाइमिस का वो कैसे laterally प्लेस करना है, यही ध्यान में अगर रह गया तो उसको एनाटॉमिकल पोजीशन में हम रख देते हैं. ठीक है, तो साइनस ऑफ एपिडिडाइमिस समझना देखना इंपॉर्टेंट है, उसमें अप्रिशिएट करना इंपॉर्टेंट है व्हेन यू हैव ग्रॉस इन फ्रंट ऑफ यू. Okay, so sinus of epididymis is very important to understand the um, whether it is the left testis or whether it is the right testis. Okay, so you have to make the sinus of epididymis on the lateral aspect. If they you have to make on the lateral aspect. Okay, outside the matlab on fix, you have to fix the sinus of epididymis on lateral aspect, you have to fix. After that you will able to differentiate whether it is right or left. Okay, so the two surfaces are very smooth and slightly convex. So here you can see the both surface are convex. Okay, so this surface is like that, convex surface, both surface. It makes like a ball. Here you can see oval ball, like if you appreciate what type of oval ball you can see. Okay, so if you know how the oval ball is formed. Okay, so now we have to discuss. So here you can see this, after that epididymis, here you can see the ductus deferens. Okay, and this is the upper pole, and this is the appendix of testis. This is the remnant of the testis. Okay, so what is the remnant of testis? Appendix of testis. And what is the sinus epididymis? It is the space of the, or reflection of the tunica vaginalis in the posterior border. Okay, lateral surface पे दिखेगा, ठीक है. Okay, so this is all about the testis, external feature. So what we can see internally, if we cut the testis, okay, if we cut the testis like that, if we cut the testis like that, okay, no, not like that, we have to cut the sagittal section, you can see. So what is the sagittal section? I have already told in the general anatomy already. So this is the man here. Okay, so this is the man here. If we cut like that, okay, sagittal section, so this is the sagittal section, longitudinal section, you can say. So what you can appreciate here, there are three layers: tunica vaginalis, tunica albuginea, and tunica vasculosa. Okay, so tunica vaginalis, tunica albuginea, and tunica vasculosa. So all the things you have to remember is written in this slide only. Okay, so here you can see it is the tunica vaginalis, and tunica vaginalis has two layers: parietal layer and visceral layer. Okay, so parietal layer, it is a serous sac representing the persistent lower portion of the processus vaginalis. Okay, so it represents the processus vaginalis. What is the remnant? It represents the processus vaginalis. Okay, invaginated by the testis from behind. Okay, so tunica vaginalis is invaginated by the testis behind and completely encloses the testis on the front of that. So front में वो totally cover करता है and posteriorly it covers partially. Okay, and it behind में क्या करता है? On the posterior border it covers the testis, but it covers the testis partially, but on the anterior border it covers the totally. Okay, so tunica albuginea, it is the thick. Here you can see tunica albuginea, you can see here. I'm going to mark this. So I am filling the color here. So this is the layer of tunica albuginea. Okay, so this is the layer of tunica albuginea. Okay, so this is a layer, it is a thick dense layer of fibrous tissue enclosing the testis, and it is covered by the visceral layer of tunica vaginalis. So it is covered by the visceral layer of tunica vaginalis. This is the visceral layer. Okay, are you able to appreciate? This is the visceral layer of tunica vaginalis. Okay, and except where it is a direct contact with epidermis. So here is a direct contact of the epidermis. After that we have cut at the section of vas deferens, but before vas deferens, what you can see? Epididymis. So at the level of epididymis, direct contact with the epididymis, where tunica vaginalis, visceral layer of tunica vaginalis is absent here. This part you can see the visceral layer of tunica vaginalis is totally absent, where there is a direct contact of epididymis. Okay, so tunica vasculosa. What is tunica vasculosa? Vasculosa, it is the innermost vascular layer of the testis, line joining the lobules of the testis. Okay, so here you can see the vas deferens and artery to the vas deferens. Okay, so here you can see the vas deferens, and from the testicular artery, here you can see artery comes and invaginates to the part of the to the substance. You can see the substance of the um, spermatic seminiferous tubule. Okay, so there is invaginates the testis part, substance of the testis, and forms the lobule. Here you can see. Okay, so some arteries invaginates and forms the lobules. Okay, so these are forms of lobules. Inside the lobules, here you can see the small seminiferous tubules also. Okay, so this part I am going to ignore right now, because this is a part of the histology. So first we have to understand the three layers at least. Okay, innermost layer of the testis lining the lobules of the testis. Okay, so it forms the what? Lobules of the testis. Understand this point? Okay, So now let's move to the artery supply. So this is the artery supply. Here you can see. So here you can see from the abdominal aorta at the level of L2, there is a release of the emergence of the two arteries known as right and left testicular artery. तो right and left testicular artery कहाँ से रिलीज होता है? right and left testicular artery कहाँ से रिलीज होता है? यहाँ पर हमारे पास, ठीक है, एब्डोमिनल एओर्टा एट द लेवल ऑफ L2, इतना बात याद रखना है, ठीक है। मैं बताऊंगा जब एब्डोमिनल एओर्टा पढ़ाऊंगा, उसमें शॉर्ट नोट्स आता है एब्डोमिनल एओर्टा पे, तो उसका पूरा ब्रांचेज उस पे लिखना पड़ता है, ठीक है। तो वो चीज आएगी जब आना होगा तो, ठीक है, ओके। So what you have to remember that it goes deep through the deep inguinal ring and inguinal canal, and after that it pierces the superficial inguinal ring and enters into testes and provides the blood. Okay, so testicular artery, it is supplied by the testicular artery which arises from the abdominal aorta at the level of L2 itself. Okay, so this is a very important question. What is the level of emergence of the testicular artery? Level will be L2. Okay, so now the very important thing is the venous drainage. Very important, that is the venous drainage of the testis. So I have covered the all part of the testis. If long answer will become, the heading will be the same. If by chance long answer will become, the heading will be the same for the testis. Okay, so you have to remember that. So there is a blood supply. I have already said artery supply. Now let's discuss the venous drainage. So whatever the veins, deoxygenated veins, are drained in that direction only na. So veins are directed that direction only. So first of all you have to appreciate what is the pampiniform plexus. So it arises, it is drained by the pampiniform plexus. I have already told in the previous lecture when I have told you the inguinal canal. So most of the time you have heard about the pampiniform plexus in that lecture. So understand this point here. Pampiniform plexus of veins are the veins emerging from the testes. These are the veins, these are bundle of veins emerging from the testes and drains in the and drains venous blood of testis into the inferior vena cava. Okay, so you have to remember it is the inferior vena cava. So it drains the directly or indirectly, it drains directly or indirectly into the inferior vena cava. How it drains? So first of all, this plexus ascends up, this plexus ascends. So this is the testis. From the testis this plexus ascends up. Okay, so this plexus ascends up. When it goes to the superficial inguinal ring. Okay, so when it goes to the superficial inguinal ring, so it condenses, these veins are condensed and forms the four veins itself. Okay, so these veins are condensed and form the four veins itself. Okay, अब उसके बाद कहाँ जाएगा? सुपरफिशियल, सुपरफिशियल से कहाँ जाएगा? ये सुपरफिशियल गया, अब यहाँ पे में डीप में जाएगा, ठीक है। अब जब ये डीप इंग्वाइनल रिंग में जाएगा, डीप इंग्वाइनल रिंग में जब जाएगा इंग्वाइनल कैनाल से होकर, देन इट विल again condense and they join to form the two testicular veins, and they again condense and joins to form the two testicular veins. Okay, so again they converge, joins to form two testicular veins. Okay, so okay, two testicular artery, sorry, vein, and these veins are accompany the testicular artery itself. Okay, so now appreciate here on the right side, you can see on the right side these veins again join and drain into the directly inferior vena cava. Right testicular vein forms the join and forms the right testicular vein and drain into the directly into the inferior vena cava. But left testicular veins, on the left side it drains into the left renal vein. Left renal vein. Okay, so at the right angle, here you can see it is joining at the right angle, and here you can see it is joining at the obtuse angle, or you can say the oblique angle, or you can say the acute angle. So you can appreciate oblique angle is the better term, because from this way you can see the obtuse angle. Okay, and from this way you can see the acute angle. So this is not the better way to say. The better way to understand the oblique angle. Okay, so here you can see it is written already. So this point I have told you, this all are written in this. Okay, so these are the points which related to the venous drainage. You have to remember, because very important for the important viva question. Okay, so maybe short answer will be asked in this. testis also. Okay, now let's discuss the embryological remnants. So there are some embryological remnants of the testis epidermis. This is the appendix of the testis, also known as hydatid of Morgagni, also known as hydatid of Morgagni, and also, sorry, this is the epidermis of appendix of epididymis. Okay, and this is the appendix of testis, and this is the superior aberrant ductules, inferior aberrant ductules. Okay, paradidymis organ of गार्डल्स. ठीक है, चलो. Now this is very important topic. Why? We have to understand basically the basic concept about the hydrocele. Okay, so for the hydrocele मतलब fluid is accumulated in the sac. Okay, some fluid is accumulated in the sac, and you know where is the sac formed? In between the tunica vaginalis layer. Okay, within the tunica vaginalis there is a parietal and visceral layer of tunica vaginalis, and there is a space in between the tunica vaginalis. I have already discussed earlier that here you can see, there is a space, this is the space between the tunica vaginalis, parietal layer and visceral layer. So in between the space there is a accumulation of fluid. Okay, accumulation of fluid within the tunica vaginalis, very important question. Okay, so fluid may collect following inflammation of the testis, because tunica vaginalis is closely related to the front and side of the testis, but most hydrocele are idiopathic. Most of the cause are not unknown, sorry, most of the cause are unknown. So basically it may be due to the inflammation of the testis, because tunica vaginalis जो होता है वो closely contact related होता है front and side of the testis. So that's why hydrocele may be appear. Okay, so fluid from the tunica vaginalis can be removed by inserting a fine trocar and cannula through the scrotal sac. So this fluid may be, so this, here you can see there is a fluid in between the tunica vaginalis. Okay, and due to that you can appreciate here tunica vaginalis totally covers the anterior border and less cover the partially covers the posterior border. Okay, so this is all about the testis. At the last we have to discuss very important short notes. If you are nothing to understand in the embryology, you have to understand the development of testis or descendant of testis. Okay, so you have to remember first how, from where the testis arises. Okay, so you already know that the testis is initially present in the abdomen, and it descends during the birth, before birth, and it descends before birth at the month of 7, 8, 9, and 9 month it descends into the scrotum. Okay, so testis develop in the retroperitoneum, close to the peritoneum, posterior abdominal wall from the genital tubercles. Okay, from it arises from the genital tubercles, and its descendant is guided by the gubernaculum. Okay, so this is very less point here. If you read the Visram Singh book, okay, of embryology, you will clearly able to understand all these points. Okay, so we will discuss also in the embryology, but for the sake of understanding purpose, we are going to discuss that now here itself. Okay, so at the 7th month it reaches to the deep inguinal link, at the 8th month it reaches to the inguinal canal, at the 9th month it reaches to the superficial inguinal pouch, and at the full term it reaches to the scrotum. Okay, so how you will remember that? So that's why I have taken this slide here, that you will not able to remember at the month. Okay, so start from 7 month, 8 month, 9 month and full term. Okay, full term में ये कहाँ होगा? स्क्रोटम में आना होता है इसको. ठीक है, next you have to remember 7, 8, 9. Okay, so 7, 8, 9. So you can go through the deep inguinal link. First you have to remember the deep inguinal link. Here you can see the deep inguinal link. There is a inguinal canal, then it will be the inguinal canal, and after that it enter to the superficial inguinal ring. Okay, pouch you can say. Okay, superficial inguinal pouch, and finally it descended into the testis, scrotum itself. So understand this point. This is very short way to understand the development of testis. In the detail we will discuss in the embryology lecture. Okay, so I think you are able to understand all these points, because this is very simple and very easy lecture today. So you will able to understand the testis and their anatomy and their embryology itself I have already discussed in short. Okay, so this is all about the today's video lecture. I hope you liked, and I hope you are going through good well. Okay, so we will discuss next topic in the next video lecture. What we have to discuss, we have to discuss peritoneum and abdominal cavity. So be prepared about that topic, how we will move this topic, peritoneum and abdominal cavity. This chapter we will discuss from the Vishram Singh book. Through the PDF we will discuss that basic point, because peritoneum is related to all about the embryology. Okay, so this is very important, and you will able to find a short note on the mesentery and epiploic foramen. Okay, so this is the two importance of, you know, that this chapter is very long, but this is not so much important for your exam. This is important for you building the concept. So that's why I will discuss the Visram Singh from the Visram Singh book PDF. Okay, so for the exam purpose we have to able to prepare these two short notes first. Okay, so I think you are following my ideas and rules. Okay, so we will discuss in the next video. For that, thank you so much. Have a nice day.